the Toronto Star, I'm Saba Itazaz, and this matters. You know how we all have that uncle from the family WhatsApp group with the elaborate conspiracy theories? Well, I persuaded mine to take the vaccine shot. And numbers show we turn around quick from a bad situation to now having among the highest vaccination rates in the world. Almost 70% Canadians have had their first doses, but that leaves more than 30% who haven't. Data already showed us that racialized minorities were the first impacted by the pandemic, yet vaccine hesitancy has also been higher in those groups. But what is vaccine hesitancy exactly? A lot of it has to do with access, with cultural barriers, and the historic trauma that some communities might have associated towards the health system. It might take a blend of public health and local community efforts to fill the gap. Some might need help with the logistics of booking. Others need more information. And it helps if it's from people you know from your own community and in a language you can trust.
I'm wearing this. This is a short t-shirt to give you an important message. I have taken my both doses of COVID-19 vaccine and I'm feeling great. So please, if you did not get yours, get your vaccine and dance Bhangra.
Let's find out how vaccine advocates are addressing vaccine hesitancy one shot at a time. Dr. Tajinder Kaura is an ER physician in the Peel region and a leading member of the South Asian COVID-19 Task Force and part of the This Is Our Shot campaign as well. Hello, Tajinder. Thank you for joining me on the podcast.
Thanks for having me.
So I know this is a little bit broad to talk about, but let's kind of talk about what exactly is vaccine hesitancy. How are vaccine hesitant different from so-called anti-vaxxers, for instance?
For sure. So vaccine hesitancy is driven by an emotion. We're emotional creatures. Human beings by nature are just emotional creatures. As much as I'd love to be a logical human being, we do a lot based on just on our emotions. So there's a lot of emotion behind, especially something like this pandemic where, we've been locked down, we've been at home, we've been away from the things we love to enjoy and feel. So the emotions are high, especially, towards the end of this pandemic, hopefully the end. Let's talk about the easy one. What's an anti-vaxxer? I hate that word because it's a very negative connotation. Everybody's a right to have their own beliefs. So I hate that word, but it is what it is. And it's really someone, in my perception, who's made this decision that they don't want to be vaccinated for whatever reason, and you're not going to be able to budge their belief because it's really a belief. So that's kind of what I see an anti-vaxxer as. So it's a belief. And when you see a hesitant, it's someone who is not against getting vaccinated, but they're just not ready. And you just kind of got to figure out why they're not ready and what we can do to help them make that decision.
And you've been working on the ground on this for a while now. How big a challenge is vaccine hesitancy in Toronto, do you think?
It's a real challenge, right? When vaccine hesitancy, when we rolled out vaccines, when we started getting vaccines out back in December, my sister works in New York and she's part of the vaccine rollout there in her organization. And she was dealing with this stuff from early November, October. So she was kind of giving me a heads up. She's like, hey, this is going to come your way as well, right? Like they're ahead of the game by a few weeks from us. She's like, this is going to come out. So start thinking about it. What are you guys going to do in your region, in your organization? And I was like, oh yeah, you're right. This is going to be a reason. So in the beginning, there's a lot of blurred lines. Is it an accessibility issue? Is it a hesitancy issue? We should only concentrate on accessibility, not hesitancy. Like, no, we need to work on everything, right? This pandemic is huge. Vaccines work. And we knew that fairly quickly that they work based on the great studies and how they were rolled out and the scientific backing. So hesitancy, we know it's going to be a big issue because there's a lot of emotions and a lot of fear, right? It's the first time in our history, if 18 months ago you had told me you would have multiple vaccines that are all excellent, I would have not believed you. I would have said, yeah, I don't think this is going to happen. But also 18 months ago, if you had told me I would have seen so many sick people from such a novel disease, I probably wouldn't have believed you either. So we knew that just with how fast the vaccines are going to be rolled out, and just because they're rolled out fast doesn't mean they're rolled out inappropriately or made too quickly. We knew that hesitancy would be an issue. So, with the South Asian COVID-19 Task Force, we came up with the idea of trying to combat this as soon as possible. So when they do become readily accessible and accessibility and supply chain is no longer an issue, everybody's ready to get the jab.
So you started in early on getting this groundwork done. What are your conversations typically like with the community members who are vaccine hesitant? Do you remember any?
Oh, yeah. So listen, again, these conversations are very interesting, right? So you're really working with a belief system and an emotional state. And whenever you're going to this conversation, you got to be ready because it's not going to be an easy conversation. This is a real conversation and it's an emotional conversation. So you need to be in the right state of mind. Like, I won't start this conversation if I'm too tired or if I haven't slept, or if my toddler just blew a fit. I'm not going to start this conversation because I want to be in the right state of mind and I want to be able to give the person I'm having this conversation to a lot because it is a very, very important conversation with huge consequences related to it. And these conversations usually, go one of two ways. I start the conversation by, hey, have you been vaccinated? And then it's usually yes or no or maybe. And then I ask them, okay, do you want to talk about why you got vaccinated or why you didn't get vaccinated? And that kind of sets up the groundwork on like, okay, where are they up in this? Do they want this conversation? Again, it's a very emotional conversation. And once they give you the reason of, yes, I do want to talk about it, you make sure, and I'll be honest with them. Like, I want to hear your why of not getting vaccinated or getting vaccinated. And not because I want to change your mind or not because I'm looking for anything, but really I want to educate myself. My idea is I want to know why you're hesitant. So if I meet someone whose mind I can change or I can walk them through this conversation, I want to be better prepared. And that's really how this conversation usually starts. And I find that helps because, again, this is a very impactful conversation. There's a lot of barriers around it already, multiple different types of barriers. And setting a safe space, non-judgmental space is so important. And as a parent to a young child, sometimes it's very easy to become more of a lecturer, quote unquote, right? And this is not a time you want to lecture. It's not a time where you want to preach. It's a time you want to listen. Really, it's more listening and you want to educate, but it's in a non-confrontational way where listening must play a key part.
Right. Listening is good at any time, actually, Sajin. There's a good point there. I do want to delve into the various layers that you mentioned of vaccine hesitancy and access and how they're two separate things. But one important thing first that seems to be on the horizon, we seem to be speeding into what many people are calling the second dose summer here in Toronto. Are we losing sight of the fact that about a quarter of the population still hasn't even gotten its first shot? What are the concerns here from a medical perspective, especially now that we know that the Delta variant is a threat as well, considering what we're seeing happening in the UK?
So I think there's a multi-layered question, but when you look at the Delta variant, and you kind of brought that up, just with the Delta variant, we know that one dose is not enough. So we do need to protect our population, right? The Delta variant is projected to become the most common variant within Ontario and probably within Canada. And we know that 2 doses of the vaccines are really good against the Delta variant. So we need to get the second jab into people's arms. And I don't think we're losing sight. I think that's not a fair assessment. I think we do have clinics that are still concentrating. The mandate for many, many clinics within the region is still to concentrate on first dose vaccines and improving first dose accessibility. But at the same time, we have people, our supply chain is so much better than what it was when we rolled out vaccines that we can start diminishing the waiting period between the first dose and the second dose. And that's the ideal, right? We want to start double vaccinating, especially with the rise of variants of concerns. Delta variant is one of them. And then, there's a possibility as we have less and less people that are vaccinated, it's possible that we have other escape variants. So we really do need to kind of bog that in. So it does help. And again, I think the 1 dose plan, it was really a supply chain issue. And now that our supply, and thankfully our supply improves week in, week out, we're getting more and more Moderna and Pfizer on the horizon. Johnson's been approved. So it's important to, yes, double vaccinate to avoid these variants of concerns. But at the same time, we are continuing our first dose vaccines and work on hesitancy. That's where, our campaign, this is our shot. That's one of the key things we're doing. It's not only bringing up you need to get your first dose, but get your second dose as well, because we know that's equally as important.
We'll be right back. Good to know that the focus is also still on the first dose, and that's also where your campaign comes in. In terms of the plan, we're talking about the 25% who still haven't gotten the first dose, which might be people who are not just vaccine hesitant, but also those who might be homebound or have other barriers to access, like disabilities or other challenges. Is your campaign and others like you aiming to focus on that?
Yeah, so there is a provincial push now towards getting everybody vaccinated. Everybody, and we got to talk about this is the social medical challenge of our generation, right? This vaccine rollout. It is the thing that will be remembered. There'll be a Netflix special about this one day.
There is, I think, on Prime.
Yeah, oh yes, yeah, you're right. Or Prime. So, this is a big deal and it is a challenge. And when we talk about the rollout, it is easy just to go out and vaccinate whoever's eligible to get them vaccinated. But at the same time, we need to work on the hesitancy piece and the accessibility piece. Within the community, within our organizations and within the community, we see more and more pop-ups happening. We see pop-ups happening at places of worship and places of faith. We're seeing more home-run community vaccine clinics running as well. We see vaccine clinics happening within the apartment buildings to increase accessibility. Again, I think this really ties into back to our supply. When our supply was poor, it was harder to do these type of things. It was easier to have more mass vaccine sites. But as our supply is improving, we can start doing more of this stuff, more of taking vaccines to people's homes, right? One of the things when we talk about accessibility, and we know how important vaccines are, in my perfect world, a vaccine becomes delivered something like by DoorDash or by Uber. You open up your app, you click a button, and the vaccine shows up to your doorstep. And that would be my ideal world. But I think we have a lot of jumps to get through to that. But hopefully, once we've vaccinated a big part of our population, and we can start doing more of the niche things like that vaccine at home.
Right. And you spoke about the various layers there are to vaccine hesitancy. And there's a lot of factors there. For some, it might be addressing fears and myths or information they've seen online. For others, it's understanding this in a way that makes sense culturally. And for some, it might be a logistics problem about booking or access to appointments. So, how are you working on vaccine hesitancy and addressing all of this and keeping all of these factors in mind?
I think, I'm not saying I'm working, it's how Canadians are working. This is really a team effort. This is Go Team Canada. There's people like Vax Hunters that have stepped up. There's people like This Is Our Shot. There's the different task force, the South Asian COVID-19 task force, the Latin American COVID-19 task force, 19 to 0. All these grassroots organizations are coming together and we're doing our best to beat this hesitancy. We're in the golden age of information. And with the golden age of information comes the golden age of misinformation. Growing up with MySpace and when Facebook was just in its early iterations, you had to go find a group, right? You had to go become a group of an anti-vax community or anti-medical community. But now, you post something on Instagram and in minutes, you can have thousands of comments of people spreading widespread misinformation, and that inundates you. And at the speed that this misinformation moves, it's quite difficult, but it's good work and it's hard work and it's work that needs to be done as a community. And I think we're all coming together kind of to do this with our campaign. This Is Our Shot. If you check out our website, thisisourshot.ca, we've tried to simplify this. We have information available in 33 different languages, and it's simple information that's easy to understand to really try to break down the myths and the misinformation around it. We do town halls. We had a very successful Instagram Live with TJ McGibbon and Dr. Osler, where we had over 2,000 people signed in to watch and listen in. And when we talk about a conversation, if you guys had listened in, it was a conversation between two people asking simple questions and really getting to the nitty gritty of vaccines and how they can affect you and what they can bring, but in simple terms, which is so important. Again, the goal is really to get that information out to people the way they consume it in simple, straightforward, easy to understand language.
Right. In Canada, we've seen throughout this pandemic how minority communities have been disproportionately affected by COVID-19. And there also seems to be more vaccine hesitancy in these communities than in the general population. What are some of the factors behind that and how your campaign tackling that? I know you specifically were working in the Peel region where the pandemic was disproportionate, as well as we saw the inequity of the rollout as well, consequently.
Yeah. So we've seen these inequities have existed in healthcare forever. This is not something new. The pandemic sadly came out and just made everything much more obvious. And these inequities were just exponentially worse. We've done a lot of work and there's a lot of work to be done to address these barriers and these inequities in terms of healthcare and this mistrust and this fear. If you look at the BIPOC community and, there's real historical reasons for this mistrust to exist. There's work that's been done by various grassroots organizations like ours, the provincial, the federal government. But this is work that I hope and that must continue post-pandemic to answer these inequities for once and for all. And when you talk about, vaccine rollout in terms of the things that I've done, we've done multiple faith-based pop-up vaccine clinics, which have been so well received by the community. One of the sentiments that come out for something like that, and where religion plays a big part in a lot of multi-ethnic communities, the growing sentiment from these religious pop-up vaccine clinics was like, my vaccine has been blessed. It's been blessed by God, by Allah, by Waheguru, which makes such a big difference. And that mindset, that thought process behind it, it really opened up the eyes to a lot of people and to myself. When I had a patient tell me that for the first time, it almost brought tears to my eye. I'm a very religious person, and hearing that, and sometimes you get very medical and I don't put too much thought into something like that. But hearing it in those words, I was like, yeah, that's true. There is something here that we can do to help beat hesitancy. And then across Canada, in BC, they just announced the first pop-up vaccine clinic for truck drivers, which again is a very ethnic group, multi-generational homes, culturally, and also like very culturally appropriate for these essential workers that kind of where the accessibility has been an issue. And I think we'll have more and more of this across the country.
You spoke about a culturally, religiously, and ethnically relevant approach to this. How important is it in that context to have a very community-based approach like the South Asian COVID Task Force and the This Is Our Shot campaign? How much of a difference does it make when this process is explained to people by people within their communities? Does that help change minds?
It's so important. When you go back to that vaccine hesitancy and having that conversation, a lot of these people are not comfortable having this conversation in English. It's not their native language. So having a grassroots organization, that community approach, you understand and you can listen and you can talk to in the language that they understand, which is so important. A lot of this work that we do with community partners and all that, when you hear patients, it's just, they're just so thankful that they can ask questions, simple questions, in their own native language. And that just simple act of just having a conversation, either in Punjabi, Hindu, Telugu, Tamil, which we do with our town halls and our video posts, makes such a huge difference.
Tajinder, from a doctor's perspective, what would you like to say to someone right now who's still on the fence about vaccinations?
Listen, if you're on the fence, it's okay to be on the fence. This is something new, something scary, something that we don't have much history with, but we do know a lot about vaccines. We know how they work. We know what they can do, and we know that this is our way out of this pandemic. If you're vaccine hesitant, have a conversation, but have a real conversation. Find out, seek out who you trust, a person that you know. It can be a pastor, it can be a priest, it can be a grantee, it can be a doctor or teacher. Seek out someone you trust, someone who knows about vaccines, and have a discussion with them. Really, if you're going to make this decision, I believe in free will. I believe in decision making. You have the right to make your own decision. But when you make the decision, you need to make sure that you weigh all the risks and the benefits together and that you are appropriately educated to make the decision. So open your mind up, hear out both sides of the story, and then make your decision. And more times than none, I think you'll make the decision to get the vaccine.
That was awesome, Tajinder. Thank you so much for your time and your insight.
Thank you.
I was speaking to Dr. Tajinder Kaura. He's an ER physician in the Peel region and a leading member of the South Asian COVID-19 Task Force and a part of the This Is Our Shot campaign. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Sabai Tazaz, Adrian Chung, and Raju Mudhar. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by SoCalled, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.